Hi, I'm Dr. Irakli Mania, and I'm a medical director at Keystone Behavioral Health. This public seminar was initially scheduled as a live event, but due to the coronavirus pandemic and the need for social distancing, we decided to present a recorded version. We will be talking about transcranial magnetic stimulation, or TMS, for the treatment of depression, with the goal of increasing the awareness of this new modality we have to help someone with depression. This is a very complicated topic, and I will try to make this presentation as simple as possible, because this is not intended for healthcare professionals. At the end, we will also try to have one of the recipients of this treatment share what their experience was with it. So let's get to it. This is the outline of today's talk. We will start by reviewing depression. When we, as psychiatrists, talk about depression, we mean major depressive disorder, sometimes called clinical depression, which presents as a combination of symptoms that one is experiencing, and not just a low mood. Major depressive disorder can be a serious condition and can lead to disability. We have gotten better at understanding and treating depression over the past few decades, and we keep making improvements. We can divide these treatments we have into three broad categories: medication, therapy, and stimulation. All three categories work by changing something in our brains, because depression is a disorder of the brain. This is an important point I want to emphasize. This is not a weakness, it is a disorder of a specific organ in our body. So medications accomplish this change by making chemical changes in our brain, and we call this chemical neuromodulation. We have several medications in our toolbox, and these can be further divided into different classes by how they work. We can use them alone or in combination. Second commonly used method is psychotherapy, also known as just therapy or counseling or talk therapy, where we make changes to the brain by merely talking and thinking. Again, we have several kinds of therapies that one can use, depending on a particular person's needs, and some examples of these are listed here. And finally, we have brain stimulation methods that aim to help by directly exciting or inhibiting particular brain region. In today's talk, we will focus on one of these, called TMS, and it seems to strike a good balance between effectiveness and side effects. So why TMS? First of all, it is effective. Sometimes we encounter depression that does not respond to standard treatment methods like medication or therapy, and we call this treatment-resistant depression, and this is where we use TMS. Data for its effectiveness is overwhelmingly positive, and it works for depression. In general, 1 in 2 have a significant response, and 1 in 3 get all the way better. This graph here from a landmark study on medications shows that if we keep going on with medications, chances of recovery get less and less with each medication trial. And by the time you have tried 3 or 4 medications, chances that the next medication will bring relief is about 5 to 10%. It is at this stage that TMS has a relatively higher likelihood of improvement. At our facility, we are happy that our numbers are even better than an average. We have 70% of our patients who have gotten significantly better, and 40% of patients have gotten all the way better. In addition to effectiveness, TMS offers several advantages. One of the main benefits is that TMS does not have any systemic side effects that are so common with medications, like weight gain, upset stomach, dry mouth, sexual side effects, etc. Also, unlike electroconvulsive therapy, where seizure is intentionally caused and patient needs to be asleep and in a hospital, with TMS there's no need for anesthesia or hospitalization. Also, unlike ECT, there is no cognitive or memory-related side effects with this treatment. Unlike vagal nerve stimulation or deep brain stimulation, TMS is non-invasive, and it does not require any surgical procedure. And finally, TMS has been established to be a cost-effective treatment modality, which means that patient and the society get their money's worth. Now let's get to talking about some basics of TMS. It is sometimes nicknamed as magnet therapy because it's using magnetic pulses to stimulate the brain. I don't know if you can see this cartoon, but women here is saying, "I heard you've been trying a magnet therapy. How is it going?" And men's reply, "I don't know. I cannot work out how to swallow them." This depicts the fact that this is not a very well-known treatment, even amongst healthcare professionals. We'll start by doing a brief historical overview. First TMS was made in England by Dr. Tony Barker, and in 2020 we have 7 devices by different manufacturers that have an FDA approval to treat this depression. We can see Tony Barker here in 1985, and again him with myself in 2019 at a conference. And between 1985 and 2020, we have 35 years of extensive research and experience that has been accumulating. Now, we all want to know how it works. Like I mentioned before, depression is a disorder of the brain. I do not want to oversimplify this, because of course there are psychological and social factors that contribute to a large extent, but we can see some differences in brains of depressed individuals. In this instance, we see some lower functioning in the brain of a depressed person. And stimulating and activating these regions can bring up a relief. And TMS can do exactly that. TMS machines convert electricity in a wall socket into a magnetic wave or a pulse that can enter and stimulate the brain without any pain. Currently, like I said, we have 7 devices from different manufacturers that are approved by FDA, and they all have their advantages and disadvantages. And in this Beyond Today seminar to talk about how they compare. At Keystone Health, we use one from Brainsway. It's the second to the left here. It stands out from the other 6 devices by the fact that it uses this helmet-like structure, which allows for a wider and deeper stimulation. And this is how it looks underneath. A specially designed and patented set of coils produced as magnetic pulses, and they enter the brain painlessly and stimulate a particular region of the brain. Next, we need to talk about indications. Who is a good candidate for this treatment? First of all, the indication is for the major depressive disorder that is severe and that did not respond to other treatment like medications. Or if we have side effects or contraindications, inability to use medications, then we would also consider this treatment. And it's an expensive treatment, but under certain conditions, this is a covered service under both Medicare and private insurance carriers. It's generally not covered service with Medicaid, except in 4 states, but this is a covered service in Franklin County, and we're grateful for this. We do not offer any off-label use of this treatment at Keystone, but TMS is widely used around the world in other psychiatric and non-psychiatric conditions. This is of course not a full list, but we can see some of the conditions that are very hard to treat and some are very common, so TMS can certainly help. Few words on special populations here. Even though this treatment is FDA approved for ages 22 to 68, there is a large pool of evidence that it is safe and effective in both adolescents and in older adults. Even pregnant women can have this treatment, but for now only in specialized research settings. And they use low-frequency stimulation, and it seems to work. We need to have more research in this area, but we know that using medications in pregnancy is not always safe, and this treatment could be even better in this regard when we have more data. Now, who will not be a good candidate for this treatment? The only firm contraindication here is presence of a metal in a head area within 12 inches of a stimulation site. Danger here is the fact that magnetic pulses can move a ferromagnetically sensitive metal, or it can heat it up. Even certain tattoos in the head area could be problematic if they contain ink that has a metal in it. Dental hardware like braces, fillings, implants, they are safe. There are some conditions that we're careful with, but they do not preclude us from delivering TMS. Some of these are about increasing risk of a seizure, some about medical devices that may malfunction. If these conditions are present, we have to really carefully weigh the risks and the benefits of the procedure. Now, we can talk about the treatment course itself. It all starts with an evaluation, an initial visit with an interventional psychiatrist like myself, who has a special training in TMS. During the first visit, doctor will conduct full psychiatric evaluation to determine if this treatment is indicated. There has to be a diagnosis of severe major depressive disorder and evidence of failures of standard treatments like medications and psychotherapy. Another indication would be intolerable side effects or contraindications to using these medications. We also need to make sure that the person does not have any contraindications to TMS, like metal in the head area. Special risk assessment tool, TAS, is used to identify any and all risk factors. Then we administer standardized depression rating scales. This is important not only to measure initial degree of depression severity, but also to measure improvement during and after treatment. It basically gives us a number that we would like to see decrease during and after treatment to indicate improvement. Finally, if we're moving forward with this treatment, we work on an informed consent, where a doctor discusses the details of the treatment proposed, benefits and risks of the treatment, and alternative treatment options, if any, so that the person is making an informed decision about proceeding with the treatment. The next step in the process is that the doctor writes up a prescription for this, much like for medications. There are certain things that the doctor can change in order to get the best outcome. For instance, we can choose the type of TMS coil or device we use, or which part of the brain to stimulate, and with what intensity or with what frequency, and for how long. We call this TMS parameters. Like we see here, we have different kinds of coils. Some stimulate deeper, some more of a service but more concentrated. Where to stimulate is very important, and we have a lot of information about this already, and we are learning more. For depression, we choose an area called dorsolateral prefrontal cortex, and it's on the left side of the brain. And there are several ways we can find this location on the head. Sometimes we use measurements, or we can use MRI images to guide us. The one we use, from BrainsWay, uses measurements, but also the fact that each coil or helmet is designed differently and are aimed to stimulate different area of the brain, depending on what we're trying to stimulate and treat. Now, moving on to the treatment itself. First of all, it's an office-based procedure, and it's done in an outpatient clinic. The very first TMS session takes a little longer, because in addition to 20 minutes of stimulation, we have to spend time to make some measurements and determine exact location and treatment and intensity. This varies from patient to patient, therefore we have to do it in the first session. Subsequent sessions are 20 minutes long. They're done 5 days a week, without restrictions in daily activities before or after treatment. It is important not to miss sessions, because change from stimulation happens when we have back-to-back sessions. This is called long-term potentiation. But to simplify, sometimes I compare this to muscle building with exercise. If we are not regular with it, change or growth does not happen. During the session, patient is sitting comfortably in a chair. They're awake with their eyes open. This part is actually important because our brain's reception to stimulation is different when our eyes are open versus closed. Patient may read, listen to music, or play something on the iPad. During stimulation, that happens every 20 seconds. The patient experiences tapping sensation on the head, Sometimes this can be uncomfortable, but we do our best for it to be tolerable. We usually do not have pain, and we do not need anesthesia. Almost everybody gets used to the stimulation and feels comfortable with treatment. We usually increase the intensity of treatment over the first few sessions. Every session is 20 minutes long, and there is always a member of the treatment team in the room. Every day we will ask questions about sleep, medication changes, any drug and alcohol use, or any side effects. These are important because it may alter the intensity with which we may need to be stimulating. Previous medications are continued, and there is some evidence that this could actually improve outcomes. Now we cannot avoid talking about side effects. In case of TMS, most side effects are mild to moderate. They're temporary and only require a symptomatic treatment. A most commonly reported side effect is a headache, but usually patients get used to it, to the stimulation discomfort. This is called habituation. We can make some adjustment to stimulation intensity or the coil location, so we rarely have to do anything else for this. Some rare and serious side effects, because TMS is loud, just like an MRI machine. We have patients and staff in the room wear sound reduction earplugs. Suicidal thoughts are possible, like with any other antidepressant treatment. We assess this daily, and it is managed like any other circumstance when patient has thoughts or plans of self-harm. Mania, hypomania is also possible, like other antidepressant treatments, and this may indicate presence of a bipolar disorder, and we may need to stop treatment or add a mood stabilizer. Now, last but not least is seizures, and this is a most feared complication, and a lot is being done before and during treatment to prevent this from happening. Fortunately, it's extremely rare, about 1 in 30,000 incidents. This risk is comparable to the risk of a seizure with antidepressant medications that tend to lower seizure threshold as well. It needs to be pointed out that all TMS-related seizures have occurred during the treatment session itself and have stopped with no consequences or progression to epilepsy or repeated seizures, meaning that we don't have to worry about seizures before or after treatment. Treatment team member is always in the room to ensure safety, and we have never had a seizure occur at our facility, and it's extremely rare. Duration of treatment, we do for 6 weeks, and then we taper down. And then we monitor response with rating scales every 2 weeks. Some response we may see as early as 2-3 weeks, but it may take longer because some patients respond late. If it does not work in this time frame, we may have to either extend treatment or change something about the treatment. It could be a different coil, different location, or we could change something about those parameters I spoke about before. And if all of this fails, we can always make a referral or offer other methods of interventional psychiatry like ECT, PNS, ketamine, etc. So now when we stop, we usually do with a taper, meaning that we slow down to 3 times a week, then twice a week, and then once a week. It is possible for patients to discontinue their medications eventually if remission is achieved, meaning complete recovery. But depression is a chronic disorder and recurrences are common, but we also have some long-lasting improvement. We have some evidence that 50% of people are still better at the 1-year mark. Continuing TMS as a maintenance treatment is certainly an option, but it is not currently reimbursed, and so we are often not able to do this. But wherever feasible, this makes sense, and it is an acceptable practice. After termination, we try to follow up with these patients and administer rating scales to identify the recurrences early. We think that early intervention makes it easier to bring this under control again. In general, TMS is the best treatment modality for treating depression in a person who has previously responded to TMS. So that's all about treatment. Let's briefly touch upon the future developments. TMS certainly has a big future, and this is some examples of what's happening. This will be used for more indications than just depression. It has already been approved for OCD. Different kinds of stimulators and coils are being developed. Accelerated TMS means that we can do more than one session per day, and this may bring a faster relief, etc. Now, combining treatments is an interesting idea, and it is being explored. Idea here is that we have a patient in the room for stimulation, and there are things that they can be doing while being stimulated that can improve the benefits or the outcomes. There is evidence that, for instance, doing therapy along with stimulation can be more beneficial. Other combination methods are also explored, like when we have patients exercise or exposed to a light box or listen to music. Themselves, these treatments have antidepressant properties and may help enhance beneficial effects of TMS if added together. So to summarize, TMS is not new. It was developed in 1985 and first approved for depression in 2008. TMS is not ECT, it's a magnet therapy versus shock therapy, which is how ECT is sometimes nicknamed. It is safe and effective procedure with no restrictions in outside activities. It is effective in treating psychiatric conditions beyond just depression, as well as non-psychiatric conditions. Usually, patient at this time is one with depression, severe depression, that has not responded to treatment with 3-4 medications and psychotherapy. It is a covered service by most insurance carriers, even though prior authorization and supporting documentation for medical necessity is often required. And then field is growing very fast. And last, I wanted to thank a lot of people at Keystone Health that made this possible for our patients. I created this map last year where we can see that we are the only deep TMS provider in the red shaded area here. And it is a large area with Pittsburgh, Toronto, Philadelphia on the edges here. And I'm very happy to be able to have this treatment in Franklin County. I will leave you with various online resources you could use to learn more about TMS and about depression treatment in general. Because we could not hold this as a live session, I will not be able to take questions. But if you have any questions, or if you want to refer a friend or a family member, please call our TMS Center number that's indicated here. I guess this concludes my talk. Please stay safe and healthy.
Hi, my name is Jeff Graham, and I am so pleased to have this opportunity to share with you how TMS ended my battle with depression. For 35 years, I was on medications. I was on antidepressants, the mainstream traditional antidepressants, and off and on I seek counseling through therapists, and off and on I did that. The medications, most didn't work for me. I can tell you that no medication ever relieved me of all the symptoms of depression. I for 35 years, and probably all my life actually, but I had a very low self-esteem, a sense of no self-worth. I was not motivated at all. I didn't mow my grass until it would get to your knees, and it was almost a joke around the house and the family, that, hey, we're gonna have to hire this week to come mow the grass. I was not the best friend. I was blessed with a lot of friends, I feel, but I was not a person to pick up the phone and call a friend, because I just didn't feel. I was always depressed. I was too depressed. And a lot of times when people would call, a friend or a family member would call, I would just watch the phone and wouldn't answer and let it take voicemail. I figured, hey, because I just didn't feel like talking. Um, that's how I was for most of my life. Little did I know, in February 2014, my it was the 23rd of February, my beautiful wife, 46 years old, she was diagnosed with stage 4 cancer and only given a short time to live. Um, at that time, I reached out to my employer they had an employee assistance program, so I got a counselor. And as she fought this bravely and courageously, and with the strength of 10 men, she fought this cancer for 18 months. She lost her battle on August 21st, 2016. It was you can imagine, by that time I was pretty much a hot mess. I wasn't functioning. I was doing what I had to, and that was it. Um, I would get up and go to work sometimes, and when I would go in there. I would just look at the computer. I was not a productive employee at all. It affected me in every way. I mean, that was an unimaginable pain like no one could ever think of. So after she lost her battle with cancer, I struggled, but I was fortunate enough to have enough time to retire. So in June of 2017, I retired from my job. And of course, I was still grieving. I was still not in a very good place at all. That's one of the reasons I retired. I lost interest. I lost interest in my job, my work. I lost interest in my friends. I lost interest in my music. As you can see, I'm sure in the background here that I'm a musician and or a part time, and I stopped on that. I was a bass player for a local church worship team for 12 years, and during this time, after I lost my wife and after I retired, they relieved me of my duties because I just wasn't doing and they were right by doing so because I wasn't doing what I was supposed to do. Had no interest in rehearsing or anything like that, so I was unprepared. Anyhow, they let me go, and that rocked my world. In October of 2017, my elderly mother moved in with me, and she was somewhat bedridden and she had dementia. So after I went through all of this, I was her primary caretaker from October of 2017 until I was in a horrific critical motorcycle accident on July 12th of 2018. And at that point, I was rushed into the hospital chamber, York Hospital, I spent 8 weeks in there. And while I was in the hospital, my mother was put in a home and lost her will to live. Um, a month after, 3 weeks after I got out of the hospital, I got home from York, my mother passed away. At this point, I thought, oh my, what more can I take? I couldn't take any more. However, I wasn't able to get out of bed because I was healing. I almost lost my leg and my life in that motorcycle accident. Thanks to the good Lord above and a full face helmet, I'm still here. My left leg is still healing, but all's well. Anyhow, I was not able to get to back to my counselor until I was able to get out of bed, which was February of 2019. And that is a month or a time that I will never forget for the rest of my life. When I got to my therapist's office, he knew what I've been through. I mean, keeps keeping in contact, in touch with what was going on in my life, and he talked to me about this new treatment. It was called transcranial magnetic stimulation, or TMS, and of course, it piqued my interest. And it just so happened that my therapist had a family member who had a personal experience with TMS in another city. And he spent an hour telling me how wonderful this treatment worked for this family member, and how things, started to work out for this person. So, he asked me if I was interested. Well, yeah, I was interested. I was ready for any relief. At this point, I was non-functional. I mean, I was not functioning. And so he called Keystone Behavior Health. He called TMS coordinator Sue Gates, got me an appointment for a consultation with Dr. Mania. I had my consultation. We set up an appointment. I went through my treatments, and I finished those May 21st, 2019. The treatments were non-invasive. They were pain-free. To me, they were relaxing. Uh, they started to relax me towards the end of the treatments, but I would say I started feeling better in between the second and third week of treatments. I kept doing, when I started treatment, I kept doing what I would say, what I call a personal inventory of myself, or a self-check, to see if, if I was feeling any better or not. And it took a while, but I thought, I started noticing little things. I used to say, in spite of myself, I think I was getting better, but I started noticing just little things, not anything major, until about, I would say, between the second and third week of treatments. Um, the whole world literally became brighter. Uh, I can remember walking outside of that building on that day, and the whole outside looked brighter. The greens looked greener, the blues looked bluer. I could hear the birds chirping. The little things that But anyhow, it was literally brighter to me. It's hard for me to explain, but it was really wild. It's been a great journey for me. Anyhow, the the staff at Keystone Behavioral Health, they are tremendous. The treatments themselves, as far as I'm concerned, was a personal journey, and they nurtured that culture for me. They made sure it was a personal journey for me. Um, they would put the music on that I wanted to listen to, and I would just sit there, and it really became relaxing after a while. But anyhow, after the treatments, um, I stopped taking I stopped taking antidepressants. It's been 13 months and 3 weeks, almost 14 months since I completed treatment. And life has gotten so much better. I can't put it into words. I feel my happiness now comes from within. I'm truly happy. When I was depressed, I had a sense of humor, but I couldn't laugh. I didn't have a hearty ha 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 laugh from within. Today I do, because I'm truly happy from within. Uh, for my, uh, I had to make some decisions in my life after treatment to make sure that I maintained my mental health the best I could. And one of the triggers for me is negativity, because I thrived on negativity and drama whenever I was in depression. And I was in a committed relationship at that time when I completed treatment. and it lasted a few months after that. But it was decided between the two of us that it was probably best that she went her way and I went mine. We kind of grew apart, I guess you could say, and that's okay. I mean, we're good. Things are okay. I also had to end a long-term friendship with a person who still to this day I think still thrives on negativity and drama, and I just cannot be around that. That's a trigger to me. So I do everything I can to stay away from negativity and drama. I look for positive in every day. Not every day is great. I mean, life's life, but I will say I'm grateful for every day. When I wake up in the morning, I have a purpose. Now, when I was going through my depression, I was a cluttered mess inside. So everything outside was cluttered. My vehicles, my desk, my room, my house. Um, Today, I live alone. My house is not always the cleanest, but it's neat. Things are in order. My life's in order. Uh, I live alone. I live alone. For most of my life, I was scared of living alone. The thought of living alone scared me. And I had no idea of responsibilities as far as paying bills, as far as I had to learn all that. And I did. And I, I used to procrastinated everything. When that didn't help my depression, when I would procrastinate, that would cause problems, and then I would worry about those problems, and those problems would just become a burden inside here, and they would just become a monster in here. Now I take care of my bills. I try to take care of issues as they come up as quickly as I can, so I don't have. When I lay my head down at night, I have a peaceful night's sleep. And I will say that probably the best testimony I could give for TMS would to have my family and my friends who wanted to help me make this video. Uh, One of them played music with me since 1992. And he said, Jeff, he said, I'd love to help you make that video if you don't mind. That's why I really don't think that's what they want. However, that might have worked okay because this guy's he knew me during this whole time and during my darkest time, the last 5 years, during those when my wife got sick, my accident, I retired. I mean, all that stuff. I mean, that just took me down. And he knew me during all those times. He was one of those friends that did. I lost a lot of friends during those last 5 years because I just wasn't not a very good friend. But this guy stuck by me, and he's played music with me for over 20 some years. And he's telling me now that I play bass now better than I ever have. I have interest. I take interest even now. I mean, before I took things for granted. Yeah, I play bass, but I take interest now. I work things out. Life isn't always, a bed of roses, but I'll tell you what, my worst day today is better than my best day whenever I was depressed. When I had my motorcycle accident, I got a very well respected lawyer here in Chambersburg. So he got to know me before TMS when I was in the hospital. But after our case was over, he sent me a text, and I still have it. And he asked me, which really threw me off, but he asked me if we could remain friends now that the case is over, because he said I was an inspiration to him. That's just wild to me, man. I don't know if I've ever been that much of an inspiration to anyone, but this guy wants to be a friend, and we are friends today, and that's pretty neat. Uh, Today I call my friends. I'll pick up the phone and I'll call them, and they laugh still, because a lot of times I'll pick up on the first call and they'll say, "Hey, my gosh, man, we're expecting, the answer machine," but no, every aspect of my life, I can't think of any that it hasn't affected in a positive way. After treatment, I felt great. Uh, but I'll get back before treatment how I felt. Before treatment, when my therapist told me about this, oh, I was so excited. I thought, yes, I had high hopes, but I had no idea. But as the time got nearer, then I started getting those old, my negative thinking was, oh, it's probably not going to work for me. I'm probably going to be in that percentile, the percentage that doesn't work for. But I like to say, in spite of myself and in spite of me, it did work. And I'm happy for that. I am so grateful to Dr. Monia and TMS coordinator Sue Gates for giving me this opportunity and for taking this journey with me. They are, I feel, a close connection to the staff, all the staff at Keystone Behavioral Health. I feel a connection to them because it was a personal journey. I did a lot of growing. I'm still growing, and I'm looking forward to tomorrow. I could never do that before. I'm looking forward to tomorrow. I'm not only paying my own bills, but I'm planning vacations. I just took a trip 2 weeks down to Tennessee, North Carolina, which I planned. I made the reservations. I did all. I was never able to do that. I always depended on everybody else. I depended on my wife or whoever was in my life at that time. So I cannot say enough. To put what TMS has done to me into words is literally impossible to do, but I certainly hope that with me sharing what I have shared, that if there's anybody out there that's sitting on the fence saying, "Oh, I'm just not sure, I'm not sure," it has, and I say it today, I'll always say it has been the best decision of my life. There was no pain. I had no side effects. There was no side effects with TMS. I didn't have headaches. I didn't have anything. It was nothing but, I can't say anything negative about it, honestly, and they're not paying me to do this. I'm more than grateful to do this. I'm very grateful. And with that, I would like to recommend this to my family and my friends, anyone who's watching this video. I do know the two of my friends who have sought TMS treatment for their depression. I haven't touched base with them to see where they're at this point, but yes, I would recommend this to my family and friends, and I hope I can help just anybody improve their life as much as mine has improved. I wish I could just open myself up and just give every person who's suffering from depression what I have in here, because I have such an inner peace in me that I never thought was possible, and it's wonderful. With that, I would like to say thank you. Thank you for your time, and goodbye.